At any one point in time, it's thought that about 60% of people are going to have some form of lower back pain. The vast majority of these don't have any neural symptoms or referring pain down into the leg. The most common treatment for this is basically to get someone moving as often and in as large a movement as possible without giving them any pain at the time. So today's video is basically going to go through some really basic to some more advanced forward bending exercises and some really basic to more advanced back bending exercises that you can do at home. The idea is you should be doing 10 repetitions of any of the exercises in the most advanced posture that you can tolerate with a big movement and no pain. So to start with, for forward bending, the very, very easiest form of the exercise, you're going to take one knee and you're just tucking it to your chest, okay? Taking it as far as you can possibly go. To get the most out of the exercise, you're going to take a big breath into your stomach, and then on the breath out, you're going to relax and tuck the knee up. Again, as I said before, you normally do it for 10 repetitions. If you can do the full range of the movement and there's no pain whatsoever, progress it to a double leg, knee to chest. Breathe in again, relax on the breath out, tuck your knees to your chest. They're both quite easy exercises, so if you're comfortable, straight away I want you to go to this exercise. On your hands and knees, hands under your shoulders, knees under your hips. First of all, you want to try and tuck your pelvis underneath you so you're rounding your lower back. Common mistake is everyone will just think about rounding through their top of their spine, whereas what I want you to do is move from this lower back around your pelvis, tucking underneath, trying to relax your tummy so you're not just bracing, and then if you're pain-free, rock backwards, holding that tuck, getting your bum down to your heels, onto your elbows, and then dipping your head. Again, with the first exercise, what I want you to do is when you get to the end of the range, take a big breath in, relax on the breath out, trying to make sure that you're not bracing through your stomach or your back, and sink into the stretch. So one more time. If you can do that pain-free, then we'll progress to the next one. If you can move 3/4 of the way through the exercise and it's pain-free, then stick with that for now. The next progression is in sitting. So the idea here is that basically we're still not taking any pressure on the legs, but we have to control our spine against gravity. Keep your feet nice and wide apart, and then from there, again, relax through your tummy, relax through your back, and then just think about slowly falling forwards towards the floor as far as you can possibly go, and come back up. When you get to the end of the range, big breath in, big breath out, sink into that stretch, and then come back up. If you get any pain through the exercise, if you feel comfortable with it, you can just go as far as you can without pain. If you feel like it starts to aggravate you, again, regress to the exercise before it. Finally, if you find that there's no problem with that one, it's just a standing toe touch. So just soften your knees. You don't have to hyperextend your knees. Your feet don't have to be close together or anything like that. Make sure that you feel stable. And then again, think about just relaxing, dropping through your shoulders, rounding out through your lower back as you fall forwards. As far as you can go, big breath in, big breath out. Come back up. 10 repetitions as far as you can go without pain. The second part of the exercise that I want you to pick one to do is a back bend. So again, as long as you're not getting nerve pain down the back of your leg or anything like that, you can do it pain-free and you don't feel like it aggravates your symptoms, then they're a very safe exercise to do. The most regressed form of the exercise, again, is in hands and knees, and it's just going to start as a tilt forwards of your pelvis, so you're getting an arch from your lower back. So the opposite movement that we did in the other 4-point kneeling exercise. So tipping your pelvis forward, trying to relax through your stomach as you do it, and then taking your big breath. Come back. 10 repetitions. If it's easy, no pain, move your hands forward. Start the exact same way, but then just slowly sink your hips into the floor. And come back up. Same idea. Tilt your pelvis, sink your hips as far as you can without pain. If it's only part way, but it's comfortable, then go to that point. Breathe in. Relax through your stomach and your back, breathe out, sink into the stretch. You don't have to go to the very end of the movement, although we do want as big a movement as possible. It has to be pain-free is the main key. If you can do that one, full range, no pain, then again you can progress to the next level, which is Doing it in standing, so you have to stabilize your back against gravity, but we're using the wall to take off a little bit of the pressure. So resting your forearms on the wall, feet about hip width apart, big breath in, big breath out, relax your hips into the wall. Generally you'll feel a slight stretch in your lower back, but again, we don't want any pain. If you feel like the exercise is a little bit too difficult, you're kind of caught between the two, just walk forwards to the wall and it's a little bit easier to do from that point. If it's a little bit easy but you can't go to the next level, walk your feet further out, do the exact same thing. Progression from there. The most common exercise we give out is doing a back bend from the floor. Bring your hands underneath your shoulders, relax through your bum and your back, and then use your arms to push your shoulders as high as you can without pain. If you do get pain, generally it's because you'll see people will tense up through their bum and their back and trying to lift through their spine. That compression and that muscle use will generally be the thing that causes pain. So really focus on relaxing. Again, if you can use your breathing to get the most out of the stretch, breathe in, pause, breathe all the way out, finish that breath out, then come back down. Again, 10 repetitions. If you can do it completely pain-free, then the end stage exercise is very simply hands on your hips or on your lower back, wherever you're more comfortable, feet hip width apart, pushing your hips forwards and bending back as far as you can go. Same thing, big breath in, big breath out at the end of the movement. Thank you.